Do you suffer with persistent neck pain that just won't go away? You may have already tried things like over-the-counter medication, ice, you may have even tried physical therapy, and you cannot figure out exactly why this pain is not going away. In today's video, we're going to be discussing the different structures that could be causing your neck pain, what you may be doing in your daily activities that's causing this neck pain to continue over time, as well as our recommendations for what you should do about your persistent neck pain. Okay. First off, we're going to start with a bit of an anatomy lesson because it's important to know what is causing your neck pain in order to know what it is you should do about it. So in our neck, we have 7 cervical vertebrae. That's what makes up our spinal column. Now, in general, the vertebrae do not become painful, but there are joints in between each of the vertebrae, and those joints can become painful. They can get arthritic, they can get tight. There's ligaments around those joints that can get pinched. There's muscles that cause normal motion of the joint when they're working correctly. However, when they stop working correctly, they can cause pinching or ligament pain. So it's not necessarily that the vertebrae are painful, it's more likely that the joints in the vertebrae are painful. So the discs are kind of a spongy substance that's in between the vertebrae, and it helps to allow the vertebrae to move normally, which is fantastic until something goes wrong. You can have a ruptured disc or a herniated disc, which can actually put pressure on the nerve and can be causing pain. Now, the discs themselves usually don't get painful. It's more likely that it's causing the joints to compress, which is causing the pain, or that you're getting some nerve irritation that's leading to pain down into your arms and hands. And of course, those nerves can get irritated. It can either be due to a disc problem, it can be due to a joint problem, or it can be due just because there's inflammation in that area. Now, the nerves also travel all the way down into the arm and hand, so it could be that you're having arm or hand symptoms, and it's actually not coming from your neck, it's coming from further down. But for the purposes of today's video, we're going to assume if you're having any arm or hand symptoms that it's because of the nerve root that's located near the disc in the vertebrae. And of course, we cannot talk about the neck without talking about all the muscles that go from the neck to the shoulder or to the rib cage or to the clavicle, which is the collarbone. All of these things are connected, and they are super important because it holds that big old head on top of our shoulders. And so these muscles have to work hard to keep everything in alignment. And if there's any kind of malalignment in your spine, that can be increasing the tension through your neck and shoulders. So muscle tension is a very common cause of your symptoms, and that's what we're going to talk about too. So muscle tension is a very common cause of persistent neck pain that people don't realize is being propagated by their daily activities. All right, so what causes persistent neck pain to start in the first place? There's 5 most common causes of persistent neck pain. The first one being poor posture. So many of us sit for work and we're sitting in this posture all day long, or we may start off in good posture. I know a lot of people who work really hard to start off in good posture, but they find themselves after an hour of meetings or being on the computer, sinking down, or maybe this is you, that you shift your weight to one side and rest on one armrest, and that causes more pressure through one side of your neck than the other. Now, you may have great posture all throughout the day while you're at your computer. You're very aware of it. You know how to keep your head over your shoulders and your shoulders over your hips. But it may be for you, it's when you're sitting on the couch at night that you put your feet up in front of you and you kind of do this leaning back, forward head kind of posture, and that's actually what causes your pain. Many people that I see here in the clinic do have some form of poor posture habit, so consider your posture throughout the day. What activities are you doing and what position are you in while you're doing them? I even have to check myself. I'm working on bodies all day long, and I have to make sure that I'm staying in that correct posture throughout the day. Now, I admit when I go home at night and I'm having to type my notes, I will tend to get into this poor posture as well. So I really feel you. But it's really important to make sure that you're staying in good posture, particularly if you have persistent neck pain. The second most common cause of persistent neck pain is muscle strain and sprain. Muscle strain and sprain can cause a lot of problems because in addition to being painful, it also can cause headaches, it can cause brain fog, it can cause the joints to not move correctly, which can lead to a whole host of problems, including problems with the discs. All of it's connected. So if you feel like you have a lot of muscle tension and strain, you definitely want to make sure that you work on it, one, to decrease your pain, but two, to prevent further injury in the future. Now, the third most common cause of persistent neck pain is degenerative disorders. So we're talking about a cervical spondylosis or a degenerative disc disease. Now, both of these are degenerative because it's actually causing changes in the joint or in the disc that are continuing to progress. In this case, you cannot necessarily change what has already happened. The goal for therapy in this point would be to stop the progression from getting any worse. Now, the most surprising potentially cause of persistent neck pain is actually improper breathing. And many people do not understand initially what I'm talking about when I say this. But if you are not breathing using your big diaphragm muscle, which is actually designed for breathing, what will happen is that you'll use your accessory muscles of respiration. And that's these muscles up in here, in your neck. So if you're using these muscles all the time because you're in a fight or flight response, it's going to cause increased tension through here. And obviously you have to breathe. So that tension is just going to continue. If that sounds like you, then I definitely recommend focusing on your diaphragmatic breathing. Getting that big diaphragm muscle to be able to breathe and move correctly will help to take off stress from your neck and decrease your persistent neck pain. Now, I do understand that persistent neck pain can be caused by reason number 5, which is trauma or injury. And it may be a trauma or injury that happened many years ago that either wasn't treated correctly or your body never fully recovered from. If that's you, there may be still some things that you can do. I have seen people 20 years after trauma or injury get results with manual hands-on physical therapy. However, I will say it is more difficult because you have 20 years of abnormal patterns going on behind that. But I want to give you some hope that there may be some things you can do, but you definitely need to seek help from a specialist physical therapist who can understand exactly what's going on with your body and give you some realistic expectations as well as discuss the timelines required for that. If you've had this trauma or injury going on for 20 years, it's going to take more than a couple of visits to fix. And it's important to find a partner that you can walk through that phase and have really open and honest discussions about what's going on during your treatment. You should always feel comfortable, no matter what practitioner you're working with, being able to ask questions and understand your treatment plan. But it is critically important if you're suffering with chronic pain or a persistent neck pain, or if this initial trauma or injury happened years ago. People get frustrated because nobody's willing to sit down and listen to the entire story. And I get it. I think that's a very important part of treatment because listening to your story combined with what my hands are telling me will help us to create that plan or to understand if there's just nothing that can be done at this point. So, what are the treatment options for persistent neck pain? Well, first off, I want to say if you have any nerve tingling or numbness in your arms or hands, you need to seek help from a specialist. No YouTube video is going to be able to describe what's going on with you and give you real treatment options. You may find some things that relieve your symptoms temporarily, but it's critically important for you to get help from a specialist regarding your particular issue. Nerve issues are a red flag and they need to be addressed immediately. Now, your treatment will be focused specifically on what's going on with you. So if your joints are stiff, we're going to get the joints moving better. If your muscles are tight, we need to decrease muscle tension. And most importantly, we need to figure out what caused this problem in the first place. If your posture needs to be addressed, we're going to work on that. If your breathing is a problem, we're going to work on that. If you need strengthening of muscles, we're going to work on that. Or stretching of muscles, we're going to work on that. And that's why it's important to find somebody who can do a really thorough evaluation, figure out exactly what's going on with you and your problem, and figure out what the best plan is to get you back to the activities that you love doing. Now, what did you learn in this video today that you haven't heard before? I would love for you to drop a comment and let me know. If you like this video, please hit that like button because that always helps the algorithm, and don't forget to subscribe. Have a great day, everyone.